Question here, a chemotherapy dose is frequently based on total body surface area. So total body surface area, shortly called BSA. So it is important for the nurse to perform which assessment before admin the chemotherapy. So if you want to measure the total body surface area, you must need some tools to measure the BSA. What they are? Measure the client abdominal width or total distension of circumference of abdomen. Calculate the client body mass index. Measure the client current height and weight. Ask the client about his or her weight and height. So you need to factor to measure the body surface area. One is the patient or client body weight and their height. So you must choose number 3. But why not I choose number 4? Number 4, ask the client about his or her body weight and height. So we do not depends on the client, whatever it is. We do by ourselves. We should measure it, right? So you choose number 4. So number 3. So what are their explanation? To ensure that the client receive optimal doses of chemotherapy, doing is usually based on total body surface areas, which require to current accurate height and body weight for measurement or calculate the body surface area. Asking the client about his or her height and weight may lead to inaccurate to determine the true body surface area measurement. So we do not depend upon them. Client with a squamous cell carcinoma. So your patient diagnosed with a squamous cell carcinoma in the larynx and also received the chemotherapeutic agents we call bleomycin intravenously. So bleomycin is a chemotherapeutic agent we use to destroy the tumor cell in squamous cell carcinoma. The nurse caring for the client and anticipate that which diagnostic study will be prescribed. As I told you, neomycin is a chemotherapeutic agent or anti-neoplastic agents. We need to special care of our patient, and bleomycin have some adverse effect over the body, especially to the lungs, right? So echocardiography or EKG or ECG, number 1 and number 2 related to the heart, but bleomycin has a bad effect over the lungs. Cervical radiography, cervix not related here, but pulmonary function test is important because bleomycin has a bad effect, side effect on lungs. So as a healthcare provider, we use the stethoscope to check the patient, auscultate their lungs to get any added sound, because bleomycin can cause fibrotic change inside the lungs. So answer 4 is good choice. What is the rationale? Bleomycin is an anti-neoplastic medication that can cause interstitial pneumonitis, which can progress to pulmonary fibrosis. Finally, patient die because of pulmonary fibrosis. It is very bad condition of the lungs. And pulmonary function study along with hematological, hepatic, and renal function tests need to be monitored. The nurse need to monitor the lung sound for dyspnea or any added sound like crackles, which indicate pulmonary toxicity. The medication needs to discontinue immediately if pulmonary toxicity developed. So what we learn? We learn that bleomycin is a chemotherapeutic agent or anti-neoplastic agents we use to destroy the tumor cell, but they have some side effect over the lungs. And patient develop pulmonary fibrosis. So when you check your patient, auscultate their lungs to check any added sound, or if patient complain the shortness of breath, we have to evaluate it. In the same time, we need to check liver function test or renal function test. So monitoring is important. Question: a client with acute myelocytic leukemia means patient have a blood cancer or white blood cell neoplasia, and it is acute myelocytic leukemia is being treated the anti-neoplastic or chemotherapeutic agents we call busulfan. Which laboratory value would the nurse specifically monitor during the treatment with this medication? So clotting time. So there does not any effect on the platelet or blood cell. Potassium level, blood glucose level. They does not change electrolyte or they does not cause hyperglycemia or hypoglycemia, but they have an effect on the kidney, right? And they increase the uric acid level and also they cause the hyperuricemia. So definitely we could choose uric acid level. They have effect on the kidney. So what is their explanation? So busulfan can cause an increase in the uric acid level or hyperuricemia, can produce uric acid, and they cause nephropathy or causes the renal stone or acute kidney injuries. So if uric acid level go up, accumulate in the body, patient develop renal stone, or uric acid causes nephropathy, means pathology in the kidney, or they can cause acute kidney injuries. So uric acid level increase is most appropriate with these chemotherapeutic agents. What next?